Hi, and welcome back to Life with a Side of Autism. My name's Leonilda, and today I wanted to talk about ABA therapy, or Applied Behavior Analysis, and basically what is ABA and how can it help people with autism. So if you're interested, stay tuned and we'll get going. If you have a child with autism, you've probably heard about ABA therapy or Applied Behavior Analysis therapy, and that is what I wanted to talk about today. ABA therapy is actually more of a treatment than a therapy, and ABA has been around, or the field of Applied Behavior Analysis or a behavior analysis has been around for probably close to 90 or 100 years, so it's nothing new. Let's just start with behavior analysis. So basically, we are analyzing behavior. That's the first part. And then the word applied just means that after we analyze the behavior, we apply what we learned to life, the real world situation. So applied behavior analysis or behavior analysis, it is a science that's out there. It's for anything with a face. So it's not just for people with autism. Applied behavior analysis or behavior analysis, you can look at for working on any type of behavior. Maybe quitting smoking, littering, blowing through stoplights, teaching children how to learn. In the field of behavior analysis or applied behavior analysis, you can get a PhD in it. So it is a hard science. And when we think of kind of the father of applied behavior analysis, most people think of B.F. Skinner. So let's think about behavior. So really, most anything is a behavior. If my phone rang, I would pick it up and say hello. I wasn't born with that. I learned that. In our life, just in the world, stimulus happens in our environment, say my phone rings, and then I react. I pick it up and say hello. I wasn't born with that skill, but I learned that skill. Skills and behaviors are basically learned, or you can unlearn them. So when we talk about a behavior, a lot of times people will say, well, I don't want to put my child in ABA or Applied Behavior Analysis setting because he doesn't have any behaviors. Well, that's wrong. We all have behavior. Me sitting here smiling in front of this camera, looking at the camera lens is a behavior. You going to YouTube and watching this video is a behavior. So behavior in terms of autism, it doesn't have to be a negative behavior or a behavior that we don't want. So applied behavior analysis has been so successful with people with autism because it's just a science of teaching and learning how to teach. So we teach people how to learn basically. Again, we can teach behaviors and we can unteach behaviors. So say with a child with autism or any disability or any genius, again, anything with a face we can teach. So when we talk about applied behavior analysis and autism, what we're looking at is teaching a person, a child, or an adult, an individual, teaching them some skills or unteaching them some skills. So for example, if we have a child who is not talking, we want more of that behavior. So we are going to put reinforcement and motivation techniques in to get more of that behavior. If we have a child who is biting or hitting and screaming, we want less of that behavior. So we're going to put in techniques that do not reinforce that behavior. So that's what we're looking at in applied behavior analysis. What's great about ABA and the way we can set up ABA treatment is basically we just practice. We practice. We might work on something 6 or 7 times in one day. And I know I hear people will say, oh, you're turning kids into robots. So I don't know where that came from, but I know that people who play the guitar, they practice a lot. They practice, and nobody says, we're turning that person into a guitar-playing genius robot. Nope. We're just giving that person a lot of opportunity and a lot of muscle memory so they can play the guitar like basically in their sleep. Pro basketball players, they go and they stand on the 3-point line and they'll shoot 100 baskets here. They'll take a step. They'll shoot 100 baskets here. They'll take a step. They will go all the way around and just keep shooting. And nobody says, we're turning him into a basketball 3-point robot. No, it's just muscle memory. So a lot of things that we're working on with kids in an ABA center are just the skills that they need, and they need more practice. And that's kind of the difference, I would say, between like a typical public education school and an ABA center, is that in the typical school, you're going to have one teacher and 10 kids, and she's got to teach kind of the same curriculum to all the kids. And in an ABA center, it's a one-to-one setting where it's an RBT, a registered behavior technician, or therapist working with each child one-on-one on what's important to that child, and just practicing the same skill over and over again. So say we have a child who, again, is just not talking or speaking as much as we want them to do. Everything we do in that treatment session is going to be maybe geared around that goal. So we might put that child in the swing and swing him twice. Then we're going to grab it and say, what do you want? And basically, at first, something's got to come out of his mouth. Like, oh, great. We're going to swing him a couple times because we just want stuff out of his mouth. Then we're going to stop and say, what do you want? And basically we're going to try to shape that where we keep wanting the child to say more and more, or sign closer and closer to the approximation of more or swing or whatever we've decided on. So they get a couple swings, we stop them, what do you want? And something's got to come out of their mouth, or they have to sign something. And they're going to just practice that over and over and over again. Say it's brushing teeth. We might, practice brushing teeth 6 times in a day. That would be hard to do like in a typical school setting. So ABA treatment or ABA therapy, it's really intense. We really work the children hard, but they really enjoy it because people love being successful. And those things are always built in to the treatment that we're working on. So we might have to take them, and at first we're just trying to get them to sit in a chair for 10 seconds. To be successful in school, you have to be able to sit in a chair, probably for a good 45 seconds to a minute. They have to be able to point. They have to, just be able to do some basic skills. So the intense autism, treatment or ABA treatment that we do, that's what we're going to work on, is what's meaningful to that child and what they need to do to be more successful in school. And we have the skills and the manpower to do that, where sometimes in a public school, like a special education class, there's just not enough staff to be able to really work intensely on the skills that the child needs. So one of the first things we do in an ABA setting, or when a person comes to us, is we always have to figure out what's the function of behavior. So there are 4 functions of behavior. The first one is a tangible item, like I want that goldfish, I want that doll, I want that Mercedes Benz, I want that Barbie dream house, I want something. That is a function of behavior. Why we do things is to get that tangible item that we want. Another reason that people do like behaviors, or we do things, is because it just feels good. I can just sit and rock in this chair, and the reinforcement of it feels good. It's soothing. I know it's probably annoying for you to watch. But again, we all have self-stimulatory behaviors. So a lot of times, you'll notice folks with autism, sometimes they, have some hand movement, some flapping, or some rocking. They do that. Sometimes there's even headbang behavior or running into a wall behavior. We all have self-stimulatory behavior. Like my big self-stim behavior is I'm an eye rubber. First thing in the morning, I am rubbing my eyes, and it feels so good. But I've learned not to do that during the day, because if I did that right now, I'd have makeup all over my face and I would be a mess. So any type of stim behavior, things that we do that, feel good. Like my grandma Mary used to do this. She would call it twiddling, and she would do the reverse twiddle, but she would just twiddle. And that was kind of a self-stimulatory behavior. It's not bad, but, there are some behaviors that you can do in public and some that, you shouldn't do in public. Again, me rubbing my eyes would not be a good thing, good behavior to do in public, because I'd be a mess and people would be like, what's up with the chick with makeup all over her face and her eyes are red? So the second one is just a self-stimulatory behavior. We do things just because they feel good. Hair twirling, anybody? chewing on a pencil. So they don't have to, really be horrible, like negative, I'm hitting my head on the floor. Like my son Brad, when he was little, he was a headbanger. And that's really upsetting. But for some reason, it felt good for him. So we had to go in and intervene because you can't let people, bang their heads on the floor. So we had to go in and intervene on that behavior. So the third type of self-stimulatory behavior is just escape. It's just to get away from something we don't like. Like a baby crying. A lot of people, nobody likes to hear a baby crying, or just like, here, do this math sheet. Oh, I'm going to fall on the floor and cry. Just anything. There's always things in life that we will do. That's like how I think procrastination came about, because there are certain tasks that we do not like to do, and we will do behaviors to get out of them. So that's the third. And then the fourth one is for attention. Like we will, engage in behavior for attention. And attention is attention, whether it's like, oh, Johnny, you are such a doll. You are such a good boy. Good for you. Thank you. Or, Johnny, if you do that one more time, I am going to scream. Knock it off. Attention is attention, whether it's nice, happy attention or somebody's upset with me attention. So that's the first thing we're going to do at an ABA center. We're going to look at the child's behaviors that we probably want to have less of and find out what's the function of that behavior. Because once we know the function of it, why they are doing it, then we can figure out how to treat it and put in substitutes. So again, to say, well, he's just doing that to make me mad. Probably not. That's not really a function of behavior, but maybe he's doing that because he gets this reaction out of you and he likes the reaction like it's an attention thing. So we have to just kind of figure out sometimes, like if we put a math sheet in front of a child or a piece of paper and a pencil and they flop to the ground, are they trying to escape that task or are they just doing it for attention? So once we know what the function of behavior is, then we can figure out how we want to treat it. Again, with behaviors that we want more, we're going to build more and more reinforcement and motivation around them. And behaviors that we don't want, we're going to do things to take away the reinforcement. So say we have a child and we want them to hold a pencil and make some marks, but the child hates doing that. So we put that down and they fall on the floor and they start to cry. Well, what we'll probably let them do is fall on the floor and cry, and we'll just wait them out. And then we'll sit them back up on the chair and they have to do that task. We're not going to allow that falling on the floor behavior to interfere with it. It's okay, go ahead and do your thing, fall on the floor. But when you're done, you're going to get up and you're going to have to do that. And then after you do it, we're going to have a reward put in right away. So for anybody, I love my job. I love working at Little Star, but I get a paycheck from Little Star and I have to have that. And my paycheck at Little Star and everybody's paycheck is basically a reinforcer. I go to Little Star to get my paycheck. I love working at Little Star, but if they took away my paycheck, I would have to change my behavior and I would have to go work someplace else to get that reinforcer. So it's the same thing with our kids, but we don't make them wait 2 weeks for a reinforcer. So with a little tiny guy, if we have a child who's 18 months or 2 years old and say we want them to sit in a chair, if they sit in a chair for 10 seconds, that might be the protocol. That might be, okay, after 10 seconds of sitting in this chair appropriately, woohoo, yay, we're going to have tickles, we're going to have bubbles, we're going to run around, we're going to high five, we're going to have some little kind of paycheck. And so we build in those reinforcers so they're oh yeah, I sit in my chair and that's what they want and I'm successful. And then maybe we'll say, okay, we're going to stretch it to 15 seconds. We're going to stretch it to 20 seconds. So those are the things that we try to do. Just little things say a child likes to jump on the trampoline and they say, first we're working just on asking appropriately. Can I have the trampoline? Sure, have the trampoline. But there's no free lunches, I guess. So after a couple times of asking appropriately for the trampoline, we'll say yes, but then they'll say, can I have the trampoline? And we'll say yes. Clap your hands. So now we're actually trying to teach them okay, how to follow directions perhaps. So can I have the trampoline? Yes, but clap your hands first. Great, go to the trampoline. And then we might say, yes, but we have to finish this worksheet or we have to do this or that. So we'll try to push out their reinforcers a little bit because Every time I say, I want a paycheck, I don't get a paycheck. I have to wait 2 weeks for it. So again, when you think of applied behavior analysis, we're taking data on everything. So if we're working with a child, say, to teach them colors, we want them to be able to discriminate their colors, we'll start, say, with the color red. And we will take data on that. So we know how many days it took for them to learn the color red. And so that's one of the beautiful things about applied behavior analysis. We can say, okay, it took them this long to learn the color red. Then say we're going to introduce the color green. And usually once you learn the first item in a category, like a color, like you learn the first color, and it just happens to be red, is the first one that we chose to teach, we know that the second one should come faster, probably about 20% faster. So say the child learned the color red in 10 days, and we know that because we took data on it. So when we're teaching the color green, we should expect to see them learning the color green by day 8. If they don't, it's not what the child has done wrong. It's what have we done wrong. We are teaching it incorrectly because they're not learning. So I think that's another really nice thing about ABA is really the ownership that we have to take. If the child is not doing something and is not being successful, they're not doing anything wrong. We're doing it wrong. So we need to go and look at that and say, this child is not learning. Let's look at the data. What do we need to do to fix it so that child can learn? Get your child into an ABA program. Again, we're going to look at getting more of the behaviors we want and less of the behaviors that we don't want. And say we have a child who you just ask them to do something and they fall on the floor screaming. Well, we don't want that because it's kind of okay when you're 3. We would expect that from a 3-year-old, but we can't have that from a 7-year-old. We can't have that from a 12-year-old. We certainly cannot have that from a 20-year-old. So we have to go in and teach a replacement behavior. And life is really about just getting your needs met appropriately, like for everybody. You say please and thank you and you get your needs met. So if we ask a child to do something and they fall on the floor, we want to teach them a way to tell us that they don't want to do that, just that's faster and more efficient and more appropriate. So the first thing we'll have to do is look at, okay, why is Johnny falling on the floor every time we ask him to wash his hands? Is it an escape behavior? He just doesn't like washing his hands and there's something aversive about it that he doesn't like? Or is he just, afraid of the water? Or just find out like what it is and then just go in and find out ways to make it more pleasant. Say you have a child and out of nowhere, they just start falling on the floor screaming. Our instinct is going to be like, Johnny, what do you want? What do you want, Johnny? What do you want? Do you want this? Do you want this? Do you want this? And so then finally Johnny's like, yes, I want my cup of milk, and takes his cup of milk. That's not the best way to ask for milk. It's certainly not the best way to get milk. But Johnny's doing it because it's worked in the past. You only do things that have worked. If something stops working, you stop doing it. So for that, we might want to try to teach Johnny that it's so much faster just to say milk or sign that he wants milk instead of just letting him fall to the floor and us just, offering him this smorgasbord of things. Maybe we'll just put a picture in front of him or like a piece of paper that has maybe the top 5 things that he requests. And then he'll just know to point to that because it's a lot quicker just to point to a picture of milk than to fall on the floor and start crying and like, do you want a movie? Do you have to go to the bathroom? Does your stomach hurt? Are you hungry? So we want to just teach the children or just teach anybody how to get their needs met the most efficiently and the most appropriately. And I'm going to make another video about this, but we have to remember that a disability and autism is not an excuse for poor behavior. Little kids can get away with stuff, but when they're older, they just can't. My son Brad is 29 and he's 6'3" and weighs like 230 pounds. He could not be flopping to the floor. He could not be pushing people. Like that would really make his world small and people would be afraid of him. So we have to ask him how to get his needs met appropriately. So the goal with any ABA therapy or treatment is to get the child in some intensive treatment so we can get them as close to their peers as possible, what their typical peers are doing, and then transition them into a less restrictive environment, which probably would be the school. And maybe we'll have to still have some support in the school. So my son, here's a story, 2011, he had a brain tumor. So the dogs are all upset. You can hear, yeah. So 2011, he had a brain tumor. What did I do? I did not bring him to, our just regular doctor. We brought him to a brain tumor specialist. So he had surgery, da-da-da-da-da-da. And so, here it is, 2019. We're still monitoring the brain tumor. It's there, but it's not as life-threatening as it used to be. But now we go back and see our regular doctor. And I think it's kind of the same thing. An ABA center is going to be an expert in autism and teaching appropriate skills. And so let's get the child into the specialist. And when they don't need that specialist anymore, then we're going to bring them back into the regular school district where they can continue and monitor their growth and development, which is their specialty. I hope that makes a little bit more sense. When we get young kids with autism in the center, if a child has 3 hours in a day that they are alert and ready to learn, like say for a little tiny guy, like say somebody who's 18 months or 2 years, if they've got 3 hours, those 3 hours, we want to be working him. And we want to be teaching him, and we want to be making hay when the sun shines. So let's get them in, let's work them hard, and then they can go home and play. But everything we do at an ABA center, it's with love and compassion, and we love the kids. We just work them hard, and we want them to be as successful as possible. And I have an aunt, Miga Michelle, and she has always said that when you're dealing with autism, time is brain. And it's really, really true. We really want to get these kids in working as early as they can, because then they have the best possible chance of the best case scenario outcome, which would be that you can't tell them apart from their typical peers, or that's not going to happen in a lot of cases. And that's okay, but we want to get them to working at their fullest potential, giving them all the tools to do as much as they can do. Some kids with autism might never talk, and that's okay. You don't have to talk to get through life, but let's teach them some functional communication. Let's teach them how to point. Let's teach them how to do some signs. Let's teach them how to use an iPad so they can get their needs met. Let's just not let them flounder. If a child comes to us at 12 and they're not toilet trained, we're going to work on toilet training, because that's huge. Nobody wants to change a 19-year-old's diapers. And that would be just so huge. First of all, cost-wise, because diapers are expensive, but just dignity-wise for that person. So, we're going to work with that kiddo and that person and get them toilet trained. And that is a huge accomplishment. So going from diapers to no diapers, that's a big deal. So those are some of the things that we work on. And, even some kids that aren't going to grow up and go to college, that's okay. Can they go to the refrigerator and get themselves some water when they're thirsty? Can they let you know when they don't feel good? We have to just look at the child like their whole life, and what they're doing now could definitely affect the trajectory of their life. And I think that's what we're trying to do with early intensive intervention. However, we've had many children that have come to us later in life that we can also teach skills to. My mom learned how to use an iPhone in her 70s. We learned throughout our whole life. My son is 29. He still gets a couple hours of therapy a week, and he's learning how to take Uber. He's learning how to cook for himself. He's learning how to do dishes. He does his own laundry. He takes care of the dogs. He has chores around the house. Just remember that we just don't want to settle and say the child has autism. We want to push them and push them and push them. And, we do it in a loving way, and you will be able to see the progress. I think another neat thing about applied behavior analysis, is that it is funded through health insurance. So health insurance does not fund things that are not evidence-based, not science-based. And again, that's a big thing about ABA. It has scientific evidence that it works, meaning we can do it on this child, and we can do the same thing on this child, and we're going to see the same results. It's not just one magic person who can work with them. But again, it's been shown across the board to increase skill, increase communications, to decrease unwanted behaviors. So insurance companies are not going to pay for something that they don't see progress on. So usually every 6 months, we have to go and redo the child's treatment plan and show that 6 months ago the child was here, now they're here. They've made this progress. I think another thing it's important to remember is autism is a medical disability. It's a chronic neurological condition. It's not an educational diagnosis. So I think it's really important that we look at it like any other medical diagnosis and follow the doctor's orders. And if your team says we think this child needs 30 hours of intensive ABA, that you get them 30 hours of intensive ABA. You make sure that they are in their treatment sessions when they're supposed to be, so they get the most effective dose of therapy, because once they're out of it, they're not going to be able to go back and make up for that time. So anyway, I hope this makes sense. I hope that will give you like a little idea about applied behavior analysis and why it's important for children with autism. I'm going to make another video about reinforcement, both positive reinforcement and negative reinforcement. And if you have any things you'd like to hear about, just about ABA or autism, or things that I might be able to help you understand a little bit better, mom-splaining, I will be happy to do that for you and explain them, hopefully in terms that, we parents can understand. Can you hear Scout the wiener dog playing with his toy? Yes. I get on the phone or turn on the camera and I've got one dog on my lap and the other two at my feet. I apologize. It's just life. You just can't plan for this stuff. Like, it happens. But anyway, have a great day. Let me know your thoughts. Please check out more Life with the Side of Autism. I'm here for you. I want to explain this so it makes sense to everybody. And remember, look towards the future.